Good afternoon and welcome to the Multicultural Media Online Conference hosted by the Ministry of Health, Multicultural Health Communication Service with the support of Multicultural New South Wales. I'm Jesusa Helaratne, Deputy Director of the Multicultural Health Communication Service, and I am your moderator for this session. I'd like to thank Director of the Multicultural Health Communication Service, Lisa Woodland, for hosting our session last time. And we are pleased to have joining us today as our special guests, Dr. Wiraaj Agnihotri, Advanced Trainee in Infectious Diseases from Health Protection New South Wales. Dr. Wiraaj, thank you for joining us.
Thanks for having me, Jesusa. Pleasure.
That's great. We have a lot of information that we're going to get from Dr. Wiraaj. And we also have with us joining online, Dr. Conrad Moreira, Public Health Physician, Public Health Unit of the Western Sydney Local Health District. He's joining us online. Thank you so much, Dr. Conrad, for joining us.
Thanks very much, Jesusa.
Thank you. Before we start, we'd like to begin by acknowledging the traditional owners of the land from which we are all joining from today. We pay respects to elders past, present, and emerging, and also our Aboriginal colleagues and community members who may be joining this session today. We also would like to pay respects to multicultural leaders, community members, and refugee communities who are represented in this session. I would like to ask, before we start, please to keep your microphones on mute, but keep your hands tapping away because I'd like you to ask your questions on the chat. We want to have a lively discussion. And we'd also like to ask you if you can put your name on the chat and tell us where you are joining from today. For us here at the Ministry of Health, we are joining you from the land of the Camaragal people of the Eora Nation. So, my colleagues from the Multicultural Health Communication Service will also be putting some links onto the chat for information that you can get from multilingual resources. We shall start with the questions here. Dr. Wiraaj, and Dr. Conrad, we are talking about staying safe and while traveling overseas, staying safe, healthy, travel overseas. And I know we have all throughout the year, it's almost December. We've been looking forward to a good holiday, so we have to keep ourselves safe. Now, what would you think in terms of including visiting family and friends? What should we be doing and how can we protect ourselves when traveling overseas?
Well, Jesusa, it's very, very important to protect yourself and your family whilst you travel overseas. And, it's a great time of year. I think the whole community has been looking forward to the holiday period, and traveling is a wonderful thing, and reuniting with close family and friends who may live overseas is definitely something that we look forward to. Now, there's a lot that you can do, a lot of simple things that you can do before you travel and whilst you're traveling to reduce your chance of getting sick whilst you're overseas. So it's important to recognize that there are countries around the world where the risk of becoming ill with certain diseases is higher than it is here at home in New South Wales. So some of the diseases to be aware of, depending on where you're traveling, include illnesses that cause vomiting and diarrhea, illnesses of the gastrointestinal system, for example, typhoid or hepatitis A. Other diseases may be associated with mosquito bites. Famous ones are dengue fever and malaria. And of course, we should remember that even illnesses that we have here at home, things like flu and COVID, can also happen whilst you're traveling overseas. So aside from these diseases, there are other factors to consider when traveling, around the food you eat, the water and the drinks you consume, around mosquitoes and insects and animals as well. So there are many things that you can do to protect yourselves, and I'd encourage everyone to take those steps in order to give yourself the best chance of having an illness-free time overseas.
Or travel even over just domestic flights and everywhere in different states as well, because the weather could be different anywhere. And I'd like to talk about food and drinks. And a lot of people go home, and I think that's something to consider. A lot of people go home and they think they can eat everything that they need to, but I think that's just being very careful. You've also mentioned about, risk of illnesses, but in terms of targeted age groups, how should we be wary about that and being careful with those, the children and older people?
Absolutely. So it's the same messaging we've had over the last couple of years, but there are certain groups within our community who are especially vulnerable to becoming ill whilst traveling, and they include very young children, the elderly, and other individuals who have chronic medical conditions or immunocompromising conditions. So if you are one of these individuals, or you're traveling with one of these individuals, then we recommend that you take extra caution to remain well whilst traveling.
Thank you. So if you have any questions with Dr. Wiraaj, please put them on the chat, and anything that you're thinking of, and any experiences you've had as well, please let us know. We'd like now to move on to Dr. Conrad, and with your experience, we'd like to find out, can you tell us some of the key things that we can do before we leave Australia to go overseas?
Yeah, thanks, Jesusa. Look, I think the most important thing for traveling is preparation. Preparation goes a long way to keeping you well, on a trip, particularly a long overseas trip. So I think doing a bit of research before you head overseas is very important. There's actually very, very good information on the internet, that people access to keep them safe and well. Looking at probably the most, famous website, if you like, or is the DFAT Smart Traveller website, which is run by the Australian government, and that has very, very good information on both not just health stuff, illnesses you can get overseas, risks, vaccinations, but also customs, cultural practices, how to carry medicine safely, and also any things that aren't actually specifically health related, like conflicts or political instability, unrest, that can actually make be hazardous for traveling. So keeping these things in mind is also important when you travel. So preparation by researching destination, I think, is one important thing. I think we're going to put the Smart Traveller link into the chat for everyone who would like to have a look. It's a very, very good place to visit. The Smart Traveller website also allows you to subscribe to receive SMS alerts if you choose to do so, because what DFAT would do is it will actually, no matter where you are in the world, send you an SMS telling you about what's happening in different countries. So if there's something relevant to the country that you're traveling in, when you're there, you know that's happening. Now, in terms of preparation as well, look, you can read about stuff, but it's also important to talk to somebody about the risk. So, visit your GP or speak to your pharmacist well in advance of your trip, so that you can actually discuss any concerns you might have about, what you might have read or what you might have heard about traveling overseas. And they can actually give you pretty good information, put those risks into context for you. Ideally, you should see your pharmacist, the GP, about 6 to 8 weeks before you go, for a number of reasons. One, so you get to think about the kind of risks that you're going to face, but also to be vaccinated before your trip. Most people think about vaccination as something that they can have the day before they leave, but it actually can take a week or two, for a lot of vaccines to start working properly, particularly if you're having it for the first time. And vaccines like, for example, rabies vaccination, you may need more than one dose to protect you before you travel. So visit them well ahead of going. And then, as I said, then get vaccinated. It's very useful when you travel. I mean, we can prepare, but you can also, without planning to, get sick overseas. So carrying a little bag of medication or a little pack of medication to treat sort of common ailments is useful. So, like your paracetamols, ibuprofen, if you get indigestion medication, antibiotics, if that's something you need. But then also non-medication things like mosquito repellents, sunscreens, oral rehydration solution, and so on. Now, a lot of people don't think that when they go overseas, they're actually exporting their own health as well. So you need to take your own medication overseas when you go, if indeed you're on regular medication for common ailments. So make sure you pack enough for the duration of your trip. And really, you should take your medicine in its original packaging. It's always a temptation to take the medication out of the box because it's actually stacks more easily in your bag when it's, But if you're asked about it by a customs official overseas, it's very, very hard for them to decipher what medicine you've got just by looking at the silver package. So take it in the box with your name, your prescription on it, and take a letter from your doctor as well, so that someone who's a medical professional is certified that you're taking this medicine for your own use. And I think the last thing is, I guess, in terms of preparation, look, a lot of bad luck happens that we don't plan for. Very, very important to make sure that you're properly insured for your trip. Travel insurance is very, very important. We mostly won't need it, But the internet, the newspapers are replete with stories about people who've actually had very, very bad luck, ended up with very, very expensive bills, and have been stuck overseas for a long time, and not been able to come back. So make sure that you have travel insurance. Research the product that's right for you, and make sure that it covers medical care overseas, repatriation, and repatriation back to Australia. So you don't have to necessarily stay overseas in an overseas hospital.
Dr. Conrad, that is very, the information that you provided, I'd like to say that I follow that. I follow that very well. So I hope I get good points for that. But really, I did do that. We did do that when we traveled just recently. And even then, even when you buy all those, the medicine supply, it's important to have extra supply, isn't it, in your bag, because it could run out. And I think that those are the things that to remember, because we do look forward to holidays. I mean, we don't get enough of them, but we do have to be sure of that. And one of the things you mentioned, Dr. Conrad, about vaccination, and you touched on the important sicknesses that could happen and that could take place if you go to different places, because there are different places. And if you do check way in advance, there are different vaccinations for different illnesses.
Absolutely, Jesusa. So vaccination is one of the most important tools that we have to protect ourselves before we go traveling. And some of the illnesses that can occur whilst traveling can be prevented altogether by vaccination. And some of them, the severity of that illness can be significantly reduced by taking a vaccination before traveling. So one of the key points is that the vaccines which you may need to take before you go traveling are dependent upon your destination. So it's very important to understand your itinerary, your destinations, and to discuss with your healthcare providers that Dr. Conrad has spoken about, your GP or your travel clinic or your pharmacist, exactly what those destinations are. So I'll give some examples of illnesses that you can prevent by getting vaccinated. So there are conditions overseas that are related to food and water that you may consume, and these illnesses can cause nasty, diseases where you have vomiting, diarrhea, and can really spoil your holiday. So hepatitis A is one such illness which can lead to liver damage, and typhoid fever is another such condition which can cause very significant nausea, vomiting, and diarrhea. There are vaccines available for both of these conditions. Another group of illnesses are those which can be passed to you by a mosquito bite. So dengue fever and malaria, again, conditions that can lead to very severe illness, are associated with mosquito bites, and there are vaccines for both of these conditions as well. And then another example I can give is that of monkeypox. So monkeypox is still present in some destinations overseas and is related to certain activities and behaviors. So again, it would be worth talking to your healthcare provider about where you'll be going, what kind of activities you'll be participating in, so that you can have the best vaccination plan to be put in place well in advance of your travel. And the last thing I want to say is, aside from all of these travel-specific vaccines, it's also very important to remain up to date with your routine vaccinations that we recommend for all people in Australia.
Now, and that's what you're saying is important, is that making sure that you check where you're going, and making sure that you also talk to your GP and pharmacist way in advance before you travel.
Exactly right.
Thank you so much. And Dr. Conrad, one of the things that Dr. Wiraaj was saying was about routine vaccinations, and flu vaccination is something that we need to be very careful of, because that's everywhere.
Yeah, that's right. That's a very, very important point that Dr. Wiraaj has made, Jesusa. And they call routine vaccinations because these diseases happen everywhere. We're normally immunized against diseases as kids, for things like diphtheria, tetanus, measles, and so on. And even as adults, we have routine or regular flu vaccination. So I guess one thing to keep in mind is that the world has two hemispheres. So we live in the southern hemisphere. We're coming into our summer, but many members of our community will travel to the northern hemisphere, which is the exact opposite, of in terms of weather and climatic conditions and what we're facing. So they're going into winter. So vaccines like flu, while we are not seeing much flu in Australia this time of the year, they are seeing actually a lot of flu in the northern hemisphere now. So flu vaccine is particularly important for travelers, and flu is actually one of the most common vaccine preventable diseases in travelers. So I guess the point to make about flu is that if you're traveling to the northern hemisphere at this time of the year, and that includes travel safe to India, to northern India, to Delhi, and so on. That's coming to the winter. It's important to make sure that you have a flu shot. To have it at least, as I said before, about 2 weeks before you travel, so it has a chance to work, before you're exposed to that environment. Dr. Wiraaj alluded to COVID, which has now become something that we're much more familiar with in the community. So ATAGI, which is the Australian government technical group on immunization, advises booster COVID vaccines for members of our community who might be at high risk. And in particular, people who are 75 years, and above, who's been more than 6 months since their last vaccine, or if they've had a COVID infection, but also people, who are age 18 to 64. So people in my age group, for example, they've not had a COVID booster this year to get one before they travel, because they are moving into areas where there is COVID transmission. I guess from the point of view of other routine vaccines, measles is a disease that we have largely controlled in Australia, but there will be members of our community who, because they've either not had the disease or not been immunized, usually because of the time when they were born, that may not be aware that they're not covered against measles, and they go to overseas, to countries where there's high measles transmissions. For example, India and Pakistan are seeing high levels of measles transmission at the moment. Indonesia was a country where there's been a lot of measles. These are people in Australia who were born after 1966 and may not have been had vaccine or been exposed to measles while they were growing up. It's important to check that you have been immunized, and if you're not sure, there's no harm in getting measles vaccine. Ideally, 2 doses of measles vaccine should be given to give them the best possible protection, and that's a very, very common disease overseas. And as I mentioned, other diseases like tetanus and so on, we get these vaccines as kids, forget about them when we grow up. But tetanus is a disease that you find in soil, an infection you find in soil, and people who get injured, if you do adventure sports or trekking or something and get injured, it's been a long time since your last tetanus vaccine. It's important to be up to date against these things as well before you go. And I think there will be a link in the chat as well, which we can put, which will give people information about the kind of vaccines they need to stay up to date with before they travel, especially the routine ones.
Thank you, Dr. Conrad. And I think there's a question by Dinesh Malhotra. Are there any precautions or steps to take if we travel interstate for holidays this summer? So Dr. Wiraaj and Dr. Conrad, I'll go back to you, but Dr. Wiraaj.
Sure. Jesusa, sorry, I just wanted to say, just draw attention to something I said earlier. I did misspeak. So just to set the record straight, with the vaccines that can protect against mosquito-related illnesses, I had said malaria and dengue. And unfortunately, at this time, we don't yet have a widely available malaria vaccine, but that will come. But what the conditions I wanted to highlight there were yellow fever, which is present in parts of Africa and South America, and Japanese encephalitis virus, which is present in parts of Asia. And there are vaccines for those too. So I just wanted to set that straight. But coming back to the question about the precautions to take when traveling interstate, there is some regional variation within Australia, and certainly there are illnesses that are circulating in our community. For example, COVID. You'd be aware that we are in an 8th wave, which is expected to rise and peak around Christmas time. So certainly all of those simple measures to protect against COVID, mask wearing, maintaining physical distance, isolating whilst unwell, or keeping distance from people who are unwell, and getting the COVID vaccination. And there are also specific risks within Australia relating to the environment this summer. So there are some parts of our country which will be subject to quite extreme heat conditions. So it's important to understand those regional variations and plan accordingly.
And I guess that's Dr. Conrad, you're talking about being safe and knowing where you're going. It's also what you're wearing, how important when you're traveling and putting things in your luggage, making sure that you've got warm clothing, or just enough to cover yourself when there's mosquitoes. Would you like to talk to that, Dr. Conrad?
Yeah, sure. So look, mosquitoes are a common cause of disease in travelers. And as Dr. Wiraaj has indicated before, particularly for people traveling overseas, dengue is actually the most common mosquito-borne disease in the world. It's found in almost every single tropical country and much more common around the equator. So for dengue, there is no easily available vaccination. And so really the best way to protect yourself is as you said, Jesusa, through mosquito bite prevention or precautions. So covering arms and legs, very, very useful. Ideally with, and I'm not a mosquito, so I can't explain their behavior, but they seem to be less attracted to light-colored clothing than dark-colored stuff. And then obviously, you can't cover every part of you. So using a mosquito repellent on any exposed skin, usually your hands, ankles, and so on, is very important. Using a tropical strength repellent is very important because the strength of the repellent relates to how long the formulation protects you for. And in countries where mosquito diseases may be a risk, having something that's going to work for a while before you need to reapply is very, very important. So clothing, hats, repellents are very, very important. If you'll be using sunscreen, because mosquitoes like warm climates, and there's usually sun in these places as well, put the sunscreen on first and then put the repellent on top, because the sunscreen is designed to stick to you and not come off even if you go for a swim, whereas the repellent comes off immediately. You go in the water or towel yourself off, and then you've got to put it on again. But yeah, mosquito precaution is very, very important. In some parts of the world, and including in Australia, tick bite is a risk. So not so much in Europe at the moment because it's pretty cold, but say in Northern Australia, if you're going out bush, making sure you wear socks and cover your ankles is important. Ticks aren't like mosquitoes. Mosquitoes will fly onto you. Ticks actually crawl onto you or come onto you from leaves as you brush through them. So I'm covering your legs, wearing socks, checking yourselves for ticks after you've been into these habitats is very important. Ticks are very devious creatures. They're very small but very devious. They will try and hide in little nooks and crannies behind your ears or other places. So doing a tick check if you're in a tick area is very, very important after you come out.
Two things I picked up there: put repellent first, or the sunscreen first, and then repellent. I think that's what you said. And also do a tick check. I think that's important, which is a great tip. In terms of keeping healthy when you're traveling, what are these things that you have to do? Exercise, make sure your food is, safe.
Absolutely, Jesusa. So there are a lot of just common sense lifestyle things that we should all be doing all the time at home and whilst we're overseas that can really stand you in good stead when you travel. So maintaining that healthy lifestyle with adequate sleep, a good, healthy, balanced diet, regular exercise where possible. These are all good things to maintain a good immune system. The other thing that people may do when they travel overseas, particularly when they're celebrating occasions with family and friends, is consume alcohol and maybe other substances. So it's just important to bear in mind that these things should be done in moderation, again, to try and preserve your health as much as possible. And then there are hygiene measures that are very important to follow as well. So washing hands frequently and using hand sanitizer when you're out and about is important. Definitely consider wearing a mask in situations where you're not able to distance from people in big crowds and around people who are experiencing respiratory illness. And certainly if you yourself are experiencing respiratory illness, and avoiding close contact with people who may be sick or experiencing symptoms. These are all very simple things that we can do. And then there are things you can do relating to eating food and drinking water. So because as we discussed earlier, food and water-related illnesses are an important risk. So if you're traveling to a place where the local tap water is not safe to drink, then make sure that you drink either bottled, boiled, securely bottled, or adequately treated water. Avoid drinking tap water or even using tap water to clean your teeth. And don't put ice in drinks because often that ice is made from tap water, which hasn't been treated. And then with regard to food, avoid eating any meat that is undercooked, avoid fresh salads and raw vegetables, and also only eat food that is served to you hot or that you have peeled, washed, prepared, or cooked yourself. And then in some places, it's important to avoid contact with water or soil that may be contaminated with urine or feces. And finally, to avoid swimming or immersing in any freshwater environments. And these include lakes, rivers, and streams, because there can be a risk of picking up illnesses from the fresh water.
We still want everyone to enjoy themselves.
Absolutely.
Yes, but we just need them to protect themselves.
Absolutely.
It's just those little reminders of not to put ice in your water, because that would not be
Unless you make the ice
and
from
yes,
treated
that's
water,
right.
for example.
Yes, because with that long list, oh my God, how are you going to? Maybe the people are watching, but how am I going to enjoy myself? That's how you enjoy yourself, if you protect and be careful.
Exactly right. It's all about taking those
Yes.
precautions, not necessarily preventing yourself from doing things, but just taking those easy steps to protect yourself and your family whilst traveling.
Yes, so we have links on the chat, as our colleague Gia Kao has been putting in, and there are lots of information, great tips in the information. Dr. Conrad, we've heard so much information today, which is fantastic. What are some good resources that many people may visit or may benefit today for our listeners, if there's any?
Yeah, thanks, Jesusa. I think I've already mentioned the DFAT Smart Traveller website, but our New South Wales Health website also has a Staying Healthy in Overseas section, which people can visit. There's tips on a Health Direct website about safe and stress-free travel, and there are also, as I said, on the DFAT website, global health warnings about what's happening in overseas. On Smart Travel website, there's also good information about, we talked about carrying medication overseas safely and securely. There's very good advice on that website about that. If you want to look at international websites, because it is the World Wide Web, the American CDC has a very, very good travelers' health website, which is information for travelers as well as health professionals. And also the UK NHS has a website called Fit for Travel, which also has good consumer level advice for people traveling overseas. If you want to go beyond Australia and you're traveling to other countries as well. But a lot of information that's very useful for consumers and also health professionals on the internet.
Thank you, Dr. Conrad. And a lot of people love animals. They like to go to the zoo. They like to visit friends with animals and pets. That's really something we should also be very particular about, or taking care. And you have tips for that.
Definitely, Jesusa. So it is, when traveling, it's probably best to avoid handling any animals, including pets. And that's because animals outside of Australia, where we have very strict biosecurity laws, regulations at home, these don't exist overseas. So the risk of becoming sick from interacting with an animal is higher overseas. So illnesses can pass from animals to humans through scratches and bites. So an example of this is rabies, which can be transmitted by a bite or a scratch from a number of different animals which may be infected. So the animals which can transmit rabies include dogs, monkeys, cats, and bats. So there are some simple things you can do to reduce the risk of becoming infected from an animal. So avoid contact with sick animals, certainly. Wash your hands very well after any contact with animals. And as mentioned earlier, don't eat any raw or undercooked meats or animal products. And if it does so happen that you're bitten or scratched or licked by an animal on an open wound, there are things you can do right there and then to reduce your risk of developing infection. So appropriate first aid to the wound, as we do all the time. Wash the wound very well with soap and water for at least 15 minutes. Use an antiseptic to prevent infection of that wound, and then seek medical advice about the risk of rabies, tetanus, and also a bacterial infection of that wound. And if you're overseas, this is where the point about travel insurance becomes very important, because if you have appropriate travel insurance, that medical advice may then be covered.
Thank you. We are almost running out of time, but I just wanted to state that I think that those tips are so important in terms of knowing where you're going, who you're visiting, if there are animals. And a lot of people go hiking or go to the zoo, as I mentioned, because that's one of the things you go to and visit. But just making sure that you have the appropriate resources and in the back of your mind, just being careful, because that's how you keep yourself safe. I've just information, Dr. Wiraaj, I traveled overseas and long flight back, was feeling okay. The next day I was tested COVID positive. So those are just things that it's good that I came home and we were fine, but that's the last thing you want would be people getting sick on their actual holiday.
Absolutely.
Have you had that experience?
I'm pleased to say, Jesusa, I try and follow all the advice that I preach. So I've been lucky, knock on wood. But I can't overstate the importance of being prepared and taking those simple steps to reduce the risk. And
that was being careful. So you could be careful and still get unwell. So I think it is important.
Exactly.
Dr. Conrad, you would say that it's important, just even taking care of yourself, just to be caution.
Absolutely. Look, millions and millions of Australians travel overseas. A few of us get sick. Mostly we get sick with ailments that get better. But I think a little common sense goes a long way in terms of keeping you safe and healthy when you travel to Jesusa. We often talk to our patients about the bad things that happen to them, but usually it's the minor things that are annoyances, such as getting gastro, as Wiraaj just said. Look, I can't say I've had Wiraaj's clean slate. I've had gastro when I've traveled overseas, and I think the more you travel, the more chances that something will happen. So I think being careful as you can, being aware of the risks before you go, so you can behave appropriately and take appropriate steps when you arrive in your destination country. And most people will have a good time and enjoy their holiday.
Thank you very much. So, Dr. Conrad, before we go, is there any last tips that you'd like to say to multicultural media for them to share to their audiences and to the health workers and community members who are online?
Yeah, I think there's a tendency to not think about risk because we live in a reasonably safe country. So I think it's important as to reiterate the points I've said before about being prepared. If you travel, thinking about what might happen, talking to a health provider or a health professional, being vaccinated, and then when you're overseas, as Dr. Wiraaj said, don't pat the monkeys or the dogs. Be careful about your food and drink. Use your mosquito repellent, and make sure you're insured. And in most cases, everything will be fine.
Thank you so much, Dr. Conrad, for joining us today. Dr. Wiraaj, any last words?
Look, I'll just reiterate the messages. Plan ahead, get vaccinated, both travel vaccines and the routine vaccines. And finally, recognize that even if you personally, when you're traveling with your family, have been fine on your previous travel overseas because maybe you grew up overseas, your children, for example, may have never been exposed to that environment or may not have had much exposure to that overseas environment, and they may well be quite susceptible to conditions or illnesses that you would think might not affect you. So it's just about thinking about everyone in your travel group and taking those simple steps to protect yourself and your loved ones.
Well, thank you so much, Dr. Wiraaj. It has been a very informative session, and I will take those tips in consideration for my next trip, which is a long way away. But for those of you traveling, please make sure to find out from the website that's been given to you on the links in the chat, and to make sure that you take care of the people that you're traveling with as well. And I think that's what you're saying, is that the conditions could be different, and the immune system of other people with you may be different.
That's correct.
Thank you, Dr. Conrad. Dr. Wiraaj, please, thank you once again for joining us. From the team here at the Ministry of Health and Multicultural Health Communication Service with Multicultural New South Wales, would like to thank you always for joining us. If you have any comments or any subjects, topics that you'd like us to consider and feature on this sessions, please let us know. But meantime, the recording of this session will be available on the Multicultural Health Communication Service website, on the New South Wales and MHCS channels as well. Please take care of yourself, plan your next holiday, and remember the tips that's been provided by Dr. Conrad and Dr. Wiraaj. Have a great day.